Now we are moving to the English session. Today is our 1911th day of continuous webinar. Thank you all the participants for joining with us. Before beginning the session, we'll have a prayer. Silent prayer. Good evening and welcome everyone for today's session. Today is our 1911th day of continuous webinar. Today's our guest is Dr. Hubert. All of you know him very well. He is a BHMS and M.Sc in psychology, running a clinic successfully for last 35 years in Karakotam. And more than that, he is an innocent moderator of IFPH. Today's our topic is management of neurological disorder with homeopathy. Dr. Hubert, you are welcome.
Thank you, Dr.
Actually, he got innocent moderator award. I think 2 years before, right?
Okay. Thank you, Doctor.
Okay.
Let me good evening to all. Good morning, good evening to all. Good afternoon to all from different parts of the world. Today, let me share my screen. Matthew 6:22, the light of the body. The eyes are like a lamp for the body. If your eyes are sound, your whole body will be full of light. Matthew 6:23, but if your eyes are no good, your body will be in darkness. So if the light in you is darkness, how terribly dark it will be. The light of the body, the eyes are like a lamp for the body. If your eyes are sound, your whole body will be full of light. If your eyes are no good, your body will be in darkness. So if the light in you is darkness, how terribly dark it will be. So last time we are talking about olfactory nerve, cranial nerves, 12 cranial nerves, and this is the second of it. That is the optic nerve. Today we are going to discuss about the eyes or optic nerve. How optic nerve working and what are the difficulties if it has any problem. So John 8:12 says, Jesus, the light of the world. Jesus spoke to the Pharisees again. I am the light of the world. He said, whoever follows will have the light of life and will never walk in darkness. So a light. In the creation it says that God says there will be light. So we got light, sun, moon, and everything. But after creating the man, if there is no eyes, means what will be there? How fearful the thing if we don't have a light. But we know that we have to understand the feelings of blind people. One person daily come to my clinic. He used to come to my clinic for something to get. I give something for him. Daily he will come. One day, one of my neighbor told that he is a fraud. He told something bad about that person. But I asked him, do you think about him ever? He does not know who you are. He does not know what is light. So I asked him, he has only belief. Only there is something. There are so many persons are there around him. There is somebody says that it is a white color, it is a black color, it is a green color. He doesn't know what is green, what is red, what is his face or his own face, he does not know. That is the condition. He has only if there is no eyes. That means that he has only some belief that around some people are. Once we know that a great singer, H.Das, made so many songs. He made so many songs. And Jain is a musician. He was a blind person. He created so many songs in Hindi film. And he once said that, I have a wish. If I get sight, I want to see H.Das. How we cannot think about it, the blindness. If we have the congenital blindness, if we have some, we can see something. After that blindness, if we have blindness, then we can understand that. But congenitally blindness, that is a very dangerous thing, and we cannot even imagine what it is. So we must be always grateful to God that we are getting this light. And see all you people within my room, I can see all of you. That is a great thing. So, optic nerve. Today we are discussing about optic nerve. This is the optic nerve. Anatomy of eye. This optic nerve. And through this, from the outward, everything entering into our life. We can see everything through our eyes. The optic nerve is the connection that lets your eyes send signals to your brain describing what they detect. Your brain takes those signals, processes them, and uses them, construct the picture you see. The optic nerve also contributes to certain eye reflexes and your circadian rhythm, which is your body's internal clock. Optic nerve is the connection that lets your eyes send signals to your brain describing what they detect. Through optic nerve, through our eyes, everything reaches our brain through this optic nerve. Your brain takes those signals, processes them, and uses them to construct the picture you see. A few minutes later, ago, Dr. Ajni Malikal said that he's an innocent person. How she could understand this? Through her perception, she can see me and she can now remember. She can remember 2 years back, she had a vision that I got an award. So she could see or imagine, she can recollect the things. Only if we have the recollections, only we will get, only if we are see a thing. Just we are seeing, that is processing. That means processing. If we are seeing a thing, and we will understand that my mother is coming, mother with a cup of tea, we can understand. This is only through this. These are all going through our optic nerve that reaches in the brain and says that if she is bringing some tea, then I think that, oh, it will not be much sugar or it will be more sugar. Everything I can see while she is coming to me. That time I can understand the things, or I think that so many things. If these are all coming through this is the processing of, whenever we get a signal, these are the processes are happening inside our brain. The optic nerve also contributes to certain eye reflexes and your circadian rhythm. We know that I took 2-3 classes of circadian rhythm. That is the internal clock. Through this internal clock, we can our life having an internal clock and the time. These are all optic nerve also contribute to certain eye reflexes and your circadian rhythm. Even the circadian rhythm, the internal clock will be affected with the optic nerve, which is your body's internal clock. Okay. Now, this is the connection. From the eyeballs, it reaches here and reaching the back of the brain. That is the occipital region. All things are our eyes connected with the occipital region or the backside of the head. That is why in Sideresia, there is eye strain. It may affect the backside of the head. The optic nerve connection that lets your eye see program. Okay. What is the optic nerve? The optic nerve is comprised of millions of nerve fibers that send visual images, messages to your brain to help you see. You have an optic nerve at the back of each eye that connects directly to your brain. Each optic nerve is a one-way connection, and it only carries signals from your eyes to your brain. Some of the signals in the optic nerve also contribute to other abilities and brain processes. It may reach the brain. Okay. What is the purpose of optic nerve? There is a purpose for optic nerve. The optic nerve is a critical part of your vision. Your eyes are like cameras with the retinas at the back of each eye, detecting light and converting what they pick up into electrical signals. The optic nerve is like the cable that carries those signals to the computer, that is your brain. The optic nerve is the second of 12 cranial nerves, which get their name from how they all directly connect to your brain. Each cranial nerve is a left and right sided pair, but experts commonly refer to them like it is just a single nerve. Now, we know, everybody knows that through our vision, retinas collecting things from outside, and it is the second optical nerve is the second cranial nerve. There are 12 cranial nerves, and we already discussed about the olfactory nerve, and now we are coming to optic nerve. Here, in the functional area of brain, we can see that one, visual area. This is, I told you, the occipital region here, from the eyes front side, from the front part to the back. It may reach the processing or the eye things are processing the back. That is why if we get a hit on the back of your head, immediately your eye having sometime it may be a temporal blindness, hit in concussion, you know, that concussion, that is the shake of brain, that time it may produce blindness. Sometimes it may be for a few minutes there will be blindness. After that, we will it may regain our vision. Though these are the going from back of the brain. The optic nerve, also known as cranial nerve 2 or CN2, is extra special among the cranial nerves because of how it forms. It is the only cranial nerve that's also part of your cranial nervous system. This is included in the cranial nervous system, CNS, along with your brain and spinal cord. The other 11 cranial nerves are part of your peripheral nervous system. We know that there is a central nervous system and the peripheral nervous system. Central nervous system is brain and related there, but the others are peripheral nervous system being included. The other 11 cranial nerves are peripheral nervous system included in the peripheral nervous system, but the optic nerve is considered as it is the CNS, central nervous system, part of central nervous system. Where is the optic nerve? You have an optic nerve at the back of each eye that connects directly to your brain. To get there, the optic nerve extend out from your retina and travel a route that includes the following: the optical canal, through this canal, there is an optical canal. This is the bony opening that your optic nerve pass through to enter your skull and reach to your brain. That is the optic canal. And optic chiasm. This Y-shaped junction is where these are all nerve fibers going to that part of. The brain, just after the separate optic nerves join at the optic chiasm, they enter your brain. Once in your brain, they head straight to the visual cortex, part of your occipital lobe, at the back of your brain. That is where most of your visual processing happens. As it travels through your brain, a small fraction of the nerve fibers branch off to other places in your brain. Those fibers don't go through processing in the visual cortex. Instead, they support abilities like the following. A part is going differently from it. It has its own actions. Pupil reflexes. The pupils of your eyes automatically adjust to let you more or less light in. That reflex needs to be fast, which is why it involves nerve fibers that branches off before they get to your visual cortex. Our pupils, we know that the pupils will reflect. It may contract and automatically adjust for each light. If some bright light is coming, that time somebody may, photophobia, we know that photophobia, that condition, they cannot tolerate the intensity of the light. We know some medicines. Which are the medicines? Photophobia. Phosphorus. Okay. Some patients may say that I can't tolerate, even I can see the things. If the horrible things they cannot see or they cannot watch the things. So sometimes they will adjust their eyes like this to see. Partially they can see. Yeah? There is also a condition. There are some brain functioning, and we know that at the same time the processing is taking place. At the same time, seeing the things and the processing is inside the brain memory and everything. So if they say that, oh, horrible, that we cannot see, they will close their eyes. Or they will watch with partial eye. These are all processing due to the processing of our eyes. Accommodation reflex. This reflex involves muscles in the ciliary body of each eye. Those muscles adjust the shape of each eye's lens. That is how your eyes automatically focus on whatever you are looking on. We know that normally we can see everything, but we don't feel that. Whenever there is a saying that once your eyes lost, the sight lost, then only we will understand the value of the eye. Everything in our body, if we lost, then only we will understand that how difficult, how much money is needed to correct it. If we are seeing that the finger of our tip, if there is a cancer, we have to find out so many lakhs of rupees for the treatment. Otherwise, we will never care that, oh, my finger, my legs. One day, one person said that, oh, why for this small finger of our leg? I had an injury on the small finger of the leg. That time, I become lame. So one of my friends said, oh, why for God place that small finger there? And without that finger, it will be a small crooked on. So I told him that if we lost the small finger, we will become lame. We have to correct it for several months to become normal walking we can do, only if we lost the small finger. So that much, because eyes are the most important part of our body. Circadian rhythm. This is like your body's internal clock. It manages your natural sleep, wake cycle and contribute to several processes like blood pressure, body temperature, and blood sugar. The optic nerve fibers that branch off for this tell your brain about the light they detect. Most people's brain use that to help anchor their circadian rhythm to daytime and nighttime. Day and night. Whenever we are in the evening time, after 8, 9 o'clock, the melatonin, serotonin levels are changing. That time we will become more sleepy. These are all through our eyes. We can understand that the light is going down. We can understand the daytime is going. And in the morning time, when we see the light of the outside of the light, then there we will rise. So these are all related with the circadian rhythm, and there is some reflexes. The eyes itself shows some action with the circadian rhythm. These are the, if there is any problem to the optic nerve, coloboma of optic nerve, glaucoma, idiopathic intracranial hypertension, neuromyelitis optica, optic nerve atrophy, optic nerve drusen, optic nerve pit, optic neuritis, septo-objective dysplasia, toxic amblyopia. These are the commonly causing disorders of the optic nerve. Let us go. There are many different types of optic nerve disorders, including glaucoma is a group of diseases that are leading cause blindness. Glaucoma usually happens when the fluid pressure inside the eyes slowly rises and damages the optic nerve. Optic neuritis is an inflammation of the optic nerve. Causes include infections and immune-related illnesses such glaucoma, everybody knows, and we will discuss it about. Then the multiple sclerosis. This is an important thing. Sometimes the cause is unknown. Optic nerve atrophy is damage to optic nerve. Causes include poor blood flow to the eye, disease, trauma, or exposure to toxic substances. Optic nerve head drusen are pockets of protein and calcium salts that build up the optic nerve over time. Here we know that glaucoma, just normal vision. Can you see it? Can you see the normal vision? Okay. We can see normally, we can see like this. Early glaucoma time, there is some black ring around the vision. That time we should understand that it is developing glaucoma. Advanced glaucoma, the dark ring will be more. And after that, end stage of glaucoma, we can only then complete loss of sight. What condition we are? Now we are in, I think that most of us in the age growing more and more, we become like. So this is glaucoma. It's a group of diseases that are leading cause blindness. Glaucoma usually happens when the blood fluid pressure inside the eye slowly rises and damages the optic nerve. The fluid inside, we know that the vitreous fluid and other fluids are there. That fluid pressure, more pressure, then there is conditions of glaucoma. Then optic neuritis, that is painful inflammation of the optic nerve. Causes include infections and immune-related illnesses, such as multiple sclerosis. Sometimes the cause is unknown, optic nerve atrophy. We know that it is a shrinkage of the optic nerve. Causes include poor blood flow to the eye. It may be due to poor blood flow. The nutrients, we will not get the nutrients required for the sight, vision, and the eye processing. So normally we say that papaya, mangoes, vitamin A content materials, we have to take more, fish, and these are all give you, the nutritions, we will get it, the nutritions from these food items, because whenever we take papaya and everything, like vitamin A, it is a fat-soluble vitamin. Fat-soluble vitamin having a quality that it may store in our fat. Normally, in B complex and everything, it may, after taking the B complex, it may go out. Immediately, water-soluble vitamins will go out. But the fat-soluble vitamins, we can store in the body. So whenever we will get conditioned, the chances, then we have to take vitamin A, papaya. These fruits are more supplying vitamins. So that multiple sclerosis damage causes include poor blood flow to the disease. We know that there are so many diseases affecting the eyes, cataract, and nowadays after taking the vaccines, multiple sclerosis is one of the side effects of taking the COVID vaccine. Trauma or exposure to toxic substances. Trauma means any injury of the eye. Trauma or exposure to toxic substances. Toxic substances means poisonous substances which irritates the eye. Sometimes there is a feeling that somebody says that there is some sand in the eye. For sand in the eye, there's you feel that sand in the eye. Why it is happening? If there is no sand, they did not get any exposure, even though they say that sand in my eye, sandy feeling in my eyes. How it is? Why? It may be due to the engorgement of the blood vessels of the eye. Small vessels are there of the eyes, and if it is slightly engorged or inflamed, that time there will be a feeling of sand in the eyes. Normally, which medicines we are using? We know that euphrasia, one of the important medicine using as an eye lotion. 5 ml, in 5 ml bottle, we take aqua plus 5 drops of euphrasia mother tincture. In addition to that, one important thing, you can use with it 2 drops of calcarea carb 30. It may give your sight improvement after using it, glaucoma. Syringia is a medicine we can use for glaucoma. 30. Syringia 30 for a long time, for 6 months. Normally, we can take Syringia normally, and we have to remove the infection. Multiple sclerosis in here. Here we can see that the damage of the external sheath, the damaged myelin sheath, nerve affected by MS, multiple sclerosis. This is normal nerve. Here, the covering of the nerve is affected. Covering of the nerve affected means that there will be painful sometimes very much painful, demyelination, that myelin sheet of the nerve will be lost. The fiber, inside the fiber, nerve fibers can be seen outside. There is chances for more infection and damage of more parts. So it may cause blindness also. Optic nerve head drusen are pockets of protein and calcium salts that build up in the optic nerve over time. There is calcium collection of the eye. The front part of the eyes in the sclera and that area will become pockets of protein and calcium salts that build up in the optic nerve over time. It may affect the sight may be deranged, or it may be destroyed, or the quality of the vision may be changed. Multiple sclerosis is a disease that causes breakdown of the protective covering of nerves. Multiple sclerosis can cause numbness, weakness, trouble walking, vision changes, and other symptoms. It is also known as MS, multiple sclerosis. What are the things? Numbness, weakness, trouble walking, vision changes, and other symptoms. It is also known as MS. The immune system attacks the protective sheet that covers nerve fibers, known as myelin. This interrupts communication between brain and the rest of the body. Eventually, the disease can cause permanent damage of the nerve fibers. It may have in certain conditions like measles, chickenpox. We may give eye lotions for what? To protect our eyes. Sometimes it may cause blindness, partial blindness in chickenpox, after chickenpox. That is to protect that. It is for we will give in measles and chickenpox. There are some skin complaints we will give. In addition to the medicine, internal medicine, we will give eye lotions, IFPH. And another medicine we can use it. Cataract. What? No. Cataract, which medicine? Eye lotion. Everybody knows, so I am not telling. These are optic nerve disorder symptoms. These are the symptoms. Blurred vision. Blurred vision. Eye pain, sometimes worsened by eye movement. Even the movement of our eyes, there may be painful. Eye movement cannot be possible. That time they say that I cannot even move my eyes. I can't open my eyes. Patient may disorders. It may be, sometimes it may be acute, or sometimes it may become chronic. Eye redness. Eye redness. Flashing lights. Halos around lights. Loss of color vision. Nausea and vomiting. Severe headache. Vision loss. Visual field loss. Blurred vision. We know that. Some dimness of vision. Blurred. We cannot understand or perceive the exact picture that is blurred. Eye pain. Eye redness. Sometimes after viral infection and viral fever, sometimes the redness may be for a long time. There are bacterial infections are there and viral infections are there. It may affect the vision or the redness may be throughout for a few months. There may be. In such conditions, we are using sulfur, a medicine which is very useful for redness of eyes, prolonged redness of eyes. Flashing lights. Cineraria martima. Everybody knows Cineraria martima, one of the medicines for glaucoma. Flashing lights. Sudden flashing of lights. Hollows around light. We can see, I show you that a ring around. Complete vision will not be get. Loss of color vision. Somebody says that it is a blue one. Others say that it's a green one. Because two persons are seeing the same thing, but one understands that, one perceives that this is a black one, or the red one, or the blue one, and there may be changes. But nobody can say that if we have the disease, we should not be very much adamant that what I saw is the right thing. Sometimes if we have the problem, we will be misguided. Now, cause nausea and vomiting. Why nausea and vomiting? Nausea and vomiting is sometimes after getting a hit, that time some nausea and vomiting. That pressure in the intracranial system of the brain may be changed. In bleeding, if there is any bleeding from any hit or an accident, that time there is vomiting. Vomiting may be caused by this hit because the intracranial pressure will be more. That is one problem. Then the other thing is severe headache. Headache because the nerves having, if there is any problem of the nerves, neuritis, that time severe headache may be. Then vision loss and visual field loss. Normally there is a vision field. Everybody have a visual field. If we can see 10 meters, if we are seeing a thing, we can normally, if we get 10 meters of our eyes can see, that vision may be reduced and coming more closer. That time we cannot see the other part of thing, only we can see the object or the object not in complete sense. This is one of the condition of cataract. While checking the dead bodies, somebody will call you and say that, please doctor, whether you know that person is dead or alive. That time, if the first and foremost confirmatory test is eye test. We know that eye test. If they have the cataract eyes, how can we check? Also, one person called me to say that whether he dead or not. They called me for he's expired. They said that he is expired. I went there and I checked his eyes. That time I saw that a small, slight shaking of his eyes. So I told him that he's alive. But they all crowded. Is he alive? Yes, I told that he's alive. So nothing, no movement, but the eyes only, it's all flickering. Only we can see just he only dead after 1 month. If I said that he is dead, what will be the condition? So another check for examining the inside in this type of conditions, if they have cataract, what will be the next test? If one is dead, somebody says that he is dead, but we will not get the if the both eyes are having the cataract, then we cannot say that eye test is not possible. In such conditions, what we will do? We have to pour cold water in the ears. That time they will tremble. So in that conditions, only possible way is to check the power cold water. Cold, icy cold water. This is the normal vision. Here, the intra pressure inside the eyes is more and it may bulge. The eyes may be bulged. We know that in the thyroid toxic conditions may also having the bulging of eyes, myxedema. So watch carefully. Eyes. Eyes give you more information of seeing a person. Whenever we see a person, we gone through his eyes, we will understand so many things. What is his condition? What is his psychological conditions? What is his disease condition? What is his pain? These are all expressions are seen through his eyes. So watching eyes, we will get 50% of the case, how they are suffering, the suffering, how much that person, how is he a loving person? He is a hatred person. He is an evil person. These are all we can understand that. The grace, that is why I told in the starting that eye is the light of our body. If the eyes is okay, the person is okay. If the eyes is not okay, that means that person is full of darkness. Glaucoma cataract developing, healthy eyes. Glaucoma, cataract. Healthy eyes, here black, beautiful eyes, here developing, and finally white. And here calcification may be there. Sometimes the redness of eyes, for a long time, we will give some person after bathing or redness of eyes. Met is the medicine. Met. In heart conditions, if there is any heart conditions or in the blood vessel conditions. And another medicine, argentum nitricum, strangulation of eye blood vessels. Argentum nitricum, one of the medicine. And I will say, every time I will say that, calcarea cup. If there is any, I told, optic nerve disorders of that numbness or like nerval disorders, there is two medicines are very important. That is causticum and hypericum. Causticum and hypericum. These two medicines can be used, very much we can use. And causticum, hypericum in higher potency is onum. Causticum also, higher potency is onum and tennum we can use. Development of glaucoma. Here we can see that the collections are there. Drainage is blocked. There is drainage. Everywhere is drainage in our body. If the drainage is blocked, that time, this here, it may be congested. The eyes will be congested. And the other materials like calcium and protein may be collected here. And that may cause cataract. Healthy eye. Glaucoma, abnormal vision, advanced glaucoma, early glaucoma, extreme glaucoma. Optic atrophy. A chronic lack of blood flow to your optic nerve can make the nerve shrink similar to how an unwanted plant withers, unwatered plant withers. We know that if we get water, a plant may grow. If it won't get water, it may shrink. That type of shrinkage, what we told that if the nutrients, we are not sufficient nutrients are getting the optic nerve, it may be shrinked or wither, atrophy, optic atrophy. Optic nerve coloboma. This is an inherited condition that affects and disrupts optic nerve development. It can happen to one or both eyes. Optic nerve coloboma, this is an inherited condition, that is congenital condition that affects disrupt optic nerve development. In such cases, we cannot, sometimes the eye transplant may be there. In optic nerve coloboma, sometimes if one nerve is affected, the other eyes can be transferred. But if the optic affected the both eyes, it is not possible for it where never they will get, even though there is eye transplant eye, it will not be helpful. Optic nerve drusen, these are deposits made on protein, calcium, and fatty compounds. They can build up at various places near the backs of your eyes, including your optic nerve. This may also cause optic nerve drusen. These are the terminology we are using: optic atrophy, optic nerve coloboma. This is an inherited condition that affects and disrupts optic nerve. Vaikam Vijayalakshmi, you know, Vaikam Vijayalakshmi, he was a singer. He's a singer. She got eyes, now vision. One film made about her. But the producer called me to make the music for that film of Vaikam Vijayalakshmi to me. And I rejected because I did not like to make music for cinema films. They insisted me they compelled me to take that film to make the music. So I was not interested to go for film industry. That is Vijayalakshmi, she got the eye transplanted. Now, common symptoms of optic nerve disorders. Optic nerve problems cause various symptoms depending on underlying condition. The symptoms may be temporary or permanent. Some of the most common symptoms include blind spots, scotomas, blind spots, blurred vision, color blindness, double vision, diplopia. Scotoma means blind spots, double vision means diplopia. The double vision, so the terminology we are using, medical terminology, is diplopia, eye irritation. Eye pain, flashing lights, headaches, nausea, night blindness. Nyctalopia, low vision, partial blindness. Blindness, peripheral side vision loss, sudden vision loss. These are some of the important optic nerve disorders. Let us go. I think that the time is over. These are the medicines. Sulfur, burning, ulceration of margin of lids. Halo around lamplight, halo, optic nerve disorders. Heat and burning in eyes, black motifs before eyes. First stage of ulceration of cornea, chronic ophthalmia with much burning and itching, parenchymatous keratosis, cornea-like ground glass. Sulfur. Another medicine, pulsatilla. Thick profuse. This is normally pulsatilla is used for acute cases of any acute eye disorders. We can use pulsatilla. A very useful medicine for acute disorders. Eyes, thick, profuse, yellow, bland discharges, itching and burning in eyes, profuse lacrimation and secretion of mucus, lids inflamed, agglutinated, styes, important medicines for stye. You use onam. Stye may absorb. Veins of fundus oculi react, enlarge ophthalmia neonatum, subacute conjunctivitis with dyspepsia, worsen. Yeah, this is normally used in acute cases, or more pulsatilla is more useful in acute disease. I think that the chronic of pulsatilla, Silesia is the important medicine for eye problems. Here, Silesia is the chronic of pulsatilla. Silesia is the chronic of pulsatilla. Eyes, angles of eyes affected, swelling of lacrimal duct, aversion to light, that is photophobia, especially daylight. It produces dazzling, sharp pains through eyes. Eyes tended to touch, worse when closed. Vision confused. Letters run together on reading. Styes. This is also used. At the same time, we can use pulsatilla and Silesia. Both are higher potencies, not lower potencies. Iritis and iridocorditis with pus. It is neuritis, optic neuritis. Perforation and slowing of corners of cornea, abscess of cornea, abscess in cornea after traumatic injury, cataract in office workers. I told you that 30 is used for. Now, here it is written there. After effects of keratitis and ulcers cornea, clearing the opacity. Another medicine, clearing. Mustard oil from mustard. Which medicine? Taking from mustard. Use 30 as potency for months. Here it is written. Other medicine is phosphorus. Eyes, cataract. Sensation as if everything were covered with a mist or veil or dust. And we know that this medicine is for diabetes also. Sometimes pulled tightly over eyes, black points seem to be float over eyes, patient sees. Better by shading eyes with hand. Fatigue of eyes and head, even without much use of eyes. Green hollow about the candlelight. Another medicine is osmium. Letters appears red. Atrophy of optic nerve. Edema of lids and about eyes, pearly white conjunctiva and long curved lashes. These are all partial loss of vision from abuse of tobacco, diplopia. Another medicine is tabacum, arsenical for this tobacco smoking, arsenical. And another medicine is ignatia. Thrombosis of retinal vessels and degenerative changes in retinal cells. Degenerative changes or soreness and curved lines are seen in old people. Retinal trouble with light and hallucination of vision. The last medicine is causticum. Eyes, cataract with motor disturbances, inflammation of eyelids, eye ulceration, sparks and dark spots before eyes. Ptosis. Ptosis means dropping of eyes. That is delphinium, also another medicine. Vision impaired as if film were before eyes. Paralysis of ocular motor after exposure to cold. The three medicines which are most important is sulfur, causticum, and silicon. The other medicines we can use. I think that the time is over. Now I can stop share.
Thank you so much, Dr. Hubert. Thank you for a wonderful session. You have prepared a lot to teach us. Great effort. I'm appreciating you. Thank you so much. And today, I would like to share one. we offer our heartfelt homage to actor Dharmendra.
कल तुझको देखा था मैंने अपने आंगन में, जैसे कह रही मुझे बात बंधन में, ऐसा रिश्ता है ये कैसे सपने हैं, बेगाने होकर भी तो लगते अपने हैं। मैं सोच में रहता हूँ, डर डर के कहता हूँ, पल पल दिल के पास।
You're hearing the sound? I stopped the sharing from the
Your
iPad.
voice is not.
Yeah, I think the song is still playing, so I couldn't. I stopped the sharing, but even though that is playing, yeah, it's finished. So, on behalf of IFPH, we are offering homage to Dharmendra. He's a legendary actor. He entertained generations and generations. And I think we don't have enough time. Otherwise, Dr. Hubert will sing a song for Dharmendra. Anyway, now
दोस्त थे
हम
हम नहीं तोड़ेंगे
yeah.
हम तेरा साथ ना छोड़ेंगे.
Yeah, IFPH is dedicating that song for Dharmendra. Anyway, they live in our heart always. Then I'm okay. Thank you everyone for your presence here. Thank you so much. If you are not present here, there is no meaning for taking classes. So come again. Good night. And I think Ram Parvesha sir want to talk. Okay, you can, sir. Only 1 minute, but.
Thank you, Andini, and congratulations, Dr. Hubert De Silva, and
Thank you.
everything. Namaskar, very nice presentation, and Dharmendra dosti आएंगे. So very thanks. And optic nerve is the very describes the lot of medicines, Silesia, pulsatilla, calcium, phosphorus, and only one medicine, stigma, is a very suitable remedy. Optic nerve.
Thank you so much, sir. Thank you so much. ये दोस्ती हम नहीं छोड़ेंगे. IFPH का दोस्ती जिंदगी पूरा नहीं छोड़ेंगे. So we will continue generations and generations. And anyway, I'm handing over the session to Dr. Hema, the Malayalam moderator. You're welcome, Dr. Hema. Thank you so much.
Thank you.
Thank you, ma'am.